Hi guys, welcome back. So it's been crazy long since I've done a video, but I thought I'd go right into it today. It's all going to be about tetracyclines, macrolides and quinolones. So the first group that we're going to start talking about is tetracyclines. Tetracyclines are broad spectrum antibiotics. They can be used for so many things such as rosacea, acne, chlamydia, malaria, lower respiratory tract infections. There's quite a few tetracyclines that you need to know about. First, I'll give you a bit of a broad idea about a couple of them. Then we'll go into the contraindication side effects for the whole group as itself, and then I'll start speaking about specific ones. Your most common tetracycline that you've probably come across already is your doxycycline. Doxycyclines tend to be taken once a day. The instructions that you'll tend to see in a community pharmacy will be something along the lines of take 2 capsules stat and then 1 capsule every day thereafter. Then you've got minocycline. With minocycline, the biggest thing is vertigo and dizziness. In comparison to all the other tetracyclines in that group, minocycline hands down causes the most vertigo and dizziness. Then you have got your oxytetracycline, your limacycline. They tend to be used for things like your acne and rosacea. Then we'll move on to side effects. Biggest sort of side effect is, in regards to the pre-reg exam, is to do with benign intracranial hypertension, which is basically a build-up of pressure in your head. So whenever you give someone the tetracycline, whenever you're counselling, a counselling point that preferably you should be telling them is if you start to experience any sort of headaches or visual disturbances, then you need to stop taking the medication. In regards to contraindications, tetracyclines are contraindicated in children under the age of 12, in pregnancy and breastfeeding. This is because tetracyclines deposit in growing bones and teeth, and because they bind to the calcium, which can cause staining of the teeth. It goes a bit of a yellow grey colour and it causes dental hyperplasia. And now moving on to renal impairment, you preferably shouldn't be using any sort of tetracyclines apart from doxycycline and minocycline. And then in hepatic impairment, tetracyclines cannot be used. Going a bit more deeper in depth in regards to quite a few other tetracyclines. Going back to minocycline, I said that it causes the most vertigo and dizziness. In conjunction to that is that it can cause irreversible pigmentation, and also it has the highest risk of causing something called lupus erythematosus-like syndrome, which is basically an autoimmune disorder where the immune system ends up attacking healthy tissues in the body. Moving on to counselling points. Well, there's 3 categories you need to know. So the first one is to do with protecting your skin from sunlight. The next one is to do with what they interact with. And the third one is in regards to swallowing the tablet whole. We'll start with the first category, which is protecting your skin from sunlight, because it makes you very photosensitive. But this counselling point is only for 2 types of tetracyclines. That is your dimeclocycline and your doxycycline, especially if it's a long course. For example, if someone's coming into the community pharmacy and they're taking the doxycycline, I don't know, for a respiratory tract infection, it's only for a couple of days, then you might not need to counsel them on that. But for example, if the dermatologist has initiated that for them, for their acne, preferably you want to be able to tell the person you need to protect your skin from sunlight. In conjunction to that, other things like wearing high SPF sun creams, etc, etc. Now moving on to your second category, how to take your tetracyclines. Do not take any indigestion remedies, antacids or any meds containing iron or zinc 2 hours before or after taking a tetracycline. That is for all tetracyclines. So just remember, I just refer to antacids / indigestion remedies, iron and zinc. However, there are 3 tetracyclines that include milk as well. So you can't take milk 2 hours before or after. The acronym DOT. So that is your dimeclocycline, your oxytetracycline, and your tetracycline. Your last category, which I think a lot of people miss when counselling, and patients end up getting really almost like a sensation of really hard heartburn, and when they're eating food and swallowing, get quite a bit of pain in their chest. This is specifically for doxycycline, minocycline and tetracycline. When they're going to take these medications, they need to make sure they're standing upright or sitting upright. They swallow the capsule whole, the tablet whole, and make sure they're in that position of being upright, standing upright for 30 minutes after, because what it can cause is irritation in your esophagus. So that counselling point tends to be missed out. So just make sure you remember that for work and for the pre-reg exam. Now, the next category is quinolones. Quinolones don't tend to be used as much as tetracyclines and macrolides, but they can still be used for things like acute prostatitis, lower respiratory tract infections, GI infections, but they just tend to be used as more like a second line, third line treatment rather than the first thing that you tend to go for. So there's 4 side effects you need to be aware of with quinolones. First one is seizures. So quinolones will lower the seizure threshold, includes people with and without a history of seizures. The next thing is tendon damage. If you look in the BNF, it will tell you that tendon damage tends to occur maybe 48 hours after taking a quinolone, or even a patient might experience it several months after stopping a quinolone. There are quite a few categories of people and situations where you wouldn't want to give a quinolone. For example, it's contraindicated in a patient who's had a history of tendon damage, tendon rupture from taking a quinolone in the past. Also, there's categories like, for example, people who are over the age of 60 years old. They're more inclined to experiencing tendon damage. Also, you have got people who are taking corticosteroids. If a patient's taking quinolone and a corticosteroid simultaneously, then they're more likely to experience tendon damage as well. So those are the groups to be aware of. That's in the BNF, so you guys highlight it, make sure you're aware of that. And then the next category is QT interval prolongation. You need to be aware of the medications that can cause QT interval prolongation, because in the exam they might give you a whole list and then you'll need to pick out which ones cause it. The one that causes the most is moxifloxacin, so just be aware of that. Last thing is arthropathy. That is a side effect of quinolones, which is basically a disease of the joints. So you wouldn't give a quinolone to a pregnant woman, to children, or growing adolescent. A bit more in depth in regards to the side effects. As I said, you need to know the categories of medications that increase the risk of QT interval prolongation. Quinolones, as I said, is one of them. Then you have got macrolides as well, which we will be coming to. You've got SSRIs, TCAs, amiodarone. So those are a few categories of medications that you should be aware of. And going back to seizures. So as I said, someone taking quinolones, they just have that bit of a higher risk of potentially getting a convulsion, but that risk increases if they are taking NSAIDs whilst taking the quinolones. The NSAIDs may induce convulsions as well, also, which might come up in the exam. I've seen it in a couple of practice papers, is ciprofloxacin and theophylline. If you take them together, it causes convulsions. Ciprofloxacin is an enzyme inhibitor, would inhibit theophylline, and a side effect of theophylline is convulsions. So that is a interaction to be aware of. Now moving on to counselling points. A counselling point to be aware of is in regards to antacid/indigestion remedies plus iron and zinc. Those categories should not be taken 2 hours before or after taking a quinolone. The only 2 quinolones where you need to avoid milk 2 hours before or after taking a quinolone is ciprofloxacin and norfloxacin. And then you've also got protecting your skin from sunlight. That counselling point only applies to 1 quinolone, which is ofloxacin. Now, last but not least, you've got your macrolides. Macrolides, you're going to see so many macrolides prescribed. It's actually got to the point where macrolides have been so overused that they're becoming quite resistant to quite a few organisms. So if we were to prescribe macrolides, preferably it should be for a short course. Macrolides, the most common ones, you have got clarithromycin, erythromycin, azithromycin. Those are the most common ones that you're going to come across. They are broad spectrum antibiotics. Azithromycin tends to be once daily. Clarithromycin tends to be twice daily, and erythromycin, you've actually got 2 doses, so either 4 times daily or twice daily. 4 times daily tends to be seen for respiratory tract infections. The twice daily tends to be used if someone has acne or rosacea. With clarithromycin, you might want to relay to a patient is actually taste disturbances. So that is something you might want to bring up to a patient. Also, a counselling point specifically for azithromycin is to do again with your indigestion remedies and antacids. So preferably when someone's taking azithromycin, do not take antacids/indigestion remedies 2 hours before or after taking the medication. This applies to erythromycin as well, but only for I believe, the gastro-resistant tablets. So if they're taking the normal tablet that doesn't have any special coating around it, then it doesn't matter. But if they're taking the gastro-resistant tablet, then the 2 hours before or after gap is included in the counselling point. So as we've said before, in regards to a few other drugs such as quinolones, macrolides cause QT interval prolongation as well. Then you have got erythromycin. So erythromycin or antibiotics make you more sensitive to having GI disturbances, so constipation, diarrhea, nausea, vomiting, abdominal pain. That's a very generic sort of category of side effects that come along with antibiotics. But specifically with erythromycin is the macrolide that causes you to become more nauseous. If you become more nauseous, that's absolutely fine. It's a common side effect with erythromycin. If you do become nauseous, you can continue taking the course of antibiotic. Macrolides are hepatotoxic. Also, at high doses, macrolides can cause something called ototoxicity, so to do with your ear. And in regards to a couple of interactions, clarithromycin, erythromycin, they're actually enzyme inhibitors. If you're taking something, for example, warfarin, then you might get an increased risk of bleeding. Another important interaction that you probably actually already come across is statins and macrolides. So when you're counselling a patient and the patient's taking a statin, you would ask them to stop taking the statin whilst they're taking the macrolide, because if they're taking it together, it can increase the chance of the patient experiencing muscle pain, muscle tenderness. That is because macrolides, as I said, are enzyme inhibitors. So there you have it. That's your tetracyclines, macrolides and quinolones. I'm pretty sure I've gone through all the important points that you guys need to be aware of. Please, if you do have any questions, just leave a comment down below. I shall reply to anything that you guys want to know about. Please share it with anyone that you know that's doing pre-reg or wants to know about antibiotics, I guess. And don't forget to subscribe and like. Thank you very much, guys. Take care.